Hi, I'm Mai Shimada. I beat the elephant path by building an online clinic providing ketamine treatment to people with depression and anxiety.
Welcome back to the Beat the Often Path podcast, the show where we help you see your life and career from a broader perspective to remind us that there are more possibilities out there than we've been sold. Joining me today is Mai Shimada, medical doctor and the founder and CEO of Isha Health, that's ISHA Health, providers of ketamine-assisted therapy. She spent many years of her life as an ER doctor, and she came to understand that ketamine was a legal and underutilized treatment option for clinically resistant depression, PTSD, and a whole range of other mental health disorders. In this episode, we are going to talk about drugs. Even though this treatment is completely legal, if that bothers you, please turn off this episode right now and go somewhere else. I'm going to preface this episode by saying that I am not a doctor nor an expert. I'm just your local neighborhood idiot who doesn't know anything about anything or anyone. So do yourself a favor and never listen to a single word that I say. But please do hear out Dr. Mai Shimada because she's an incredible human and she's joining us today. Do you happen to listen to dance music, Mai, by any chance?
Every once in a while.
Okay, because when I want to start this episode, I feel like I should do it like one of those old DJ scratch tools, like, ladies and gentlemen, today we're going to talk about drugs. That is a bit of a disclaimer, but you're like, this is wildly inappropriate already. But no, it is an interesting topic. So many people suffering from depression, so many people out there wondering what the heck it is all for, especially during the pandemic and during all of these crazy times. Depression is running rampant. This is a very hot topic in general, so explain to me and to all of us how you got involved and what you do.
Yeah, sure. So, as you mentioned, depression is such a huge issue, not just limited to America, but globally. 322 million suffer from depression, and 1/5 of the American population suffer from a form of mental health. So, there's really such a big issue, and particularly for depression treatment, even when you go through those medication treatments, psychotherapy session, about 1/3 of the people with depression become treatment resistant, meaning they don't respond to the treatment that's available, right? And what do? There's really no good option right now. So there are newer treatment coming into this treatment. One of them is ketamine. So ketamine is a substance that was originally approved by FDA in 1970, originally as an anesthetic. So it's being used mostly in a setting of emergency room, operating room for the purpose of sedation, pain control, anesthesia. But for the past 10 years or so, it's been increasingly used for the treatment of mental health. And in 2019, intranasal esketamine Spravato was approved by FDA for treatment-resistant depression, and more clinicians are using ketamine for the treatment of depression, anxiety, and other related mental health illnesses. However, many of those treatments are delivered in an in-person clinic, which is really hard to access for many people, especially if you're struggling with severe depression and anxiety. It's really hard to get out, to do anything, motivated to do anything. So we created this online clinic to be able to make this effective treatment for depression, ketamine treatment, accessible for more people.
Wow. So when we talk about treatment-resistant depression, what types of treatment are we talking about? Is that just other types of drugs?
Yeah, so by definition, treatment-resistant depression is defined by people with depression who do not choose more pharmacological treatments such as SSRI and other treatments. So that's the definition. But in reality, many people have gone through more than two medications and multiple modalities of the psychotherapy sessions, and even after years of treatment, many of them improve to some degree, but not really quite to the point where they want to be. They continue to have low mood, and even when they respond to the certain medications and the depression symptoms get somewhat better, they tend to suffer from many side effects, which makes it really hard to continue the treatment. So that's the struggle with the treatment-resistant depression.
I want to talk about your personal journey because you worked in the ER. Like you said, this has been a product that's been administered. It's been approved since the 1970s. It's been used in emergency room situations for a long time. So talk to me about your experience in that very crazy, traumatic environment and how that led to you having this idea to maybe branch out and build it as another concept.
Yeah. So as you mentioned, I am board certified emergency physician. So I worked in ER for about 10 years or so, and yeah, I use ketamine a lot mostly for the purposes that I mentioned earlier, for sedation and pain control. And when I was using ketamine for those purposes, I haven't really thought about the its implication for mental health per se, because it was just one of the medication we use for sedation. But while I was working in ER, I started to question some of the practice that we employ in ER. We see a lot of mental health patients in ER because of the lack of resources. They have nowhere else to go, so they end up coming to ER. So we work with a lot of patients struggling with mental health. Although what we do in ER is basically to medically clear them and refer them to the psychiatrist or whatever facility that is appropriate for them. And those patients tend to just keep coming back. And those are the patients who specifically come for mental health reasons. And there is another big population of patients who come to ER for various complaints such as migraine or hypertension, high blood pressure, or anxiety, not necessarily manifesting as anxiety, but more feeling of like insomnia is another one, or chronic pain. All those symptoms are, they come to ER with those symptoms, so we treat them, right? Like we address the pain. If they're having high blood pressure, we try to control blood pressure, etc. But whenever I look at those patients, there tend to be underlying mental health issues that lead them to develop those medical conditions. Many of those patients are suffering from depression, anxiety, even when they haven't been diagnosed with. And that realization made me feel that we have to approach mental health in a different way, not just putting a Band-Aid on to just have them less experience of the symptoms that they're having, but more we need to address this at a more fundamental way. So that led me to explore different treatment options for depression and anxiety. And ketamine treatment caught my attention, partially because one of our family members who had been struggling with treatment-resistant depression for some time, he was started on ketamine treatment by about 4 years ago by now.
Wow.
And yeah, that really changed his life. And
Wow.
that kind of opened my eyes around ketamine for mental health indications, not in a way that I had before. And from there, I started reading a lot of articles around it and realized that there's a lot of robust evidence behind ketamine for, especially for treatment-resistant depression, and more indications are being researched right now. And from there, I started to research more into psychedelics, like serotonin agonists, such as psilocybin, and other substances that are being in clinical trials. And as I read more, I was surprised how much potential those compounds have at the level that we haven't really seen in the mental health treatment. So that got me really excited about this field.
Completely agree. I'm also equally excited. So what is it about then ketamine versus psilocybin? We know there are a few things, LSD, acid. We know there are a few different things in this category, broadly speaking. So why did you choose this one of the others? And how has that been building this out?
We chose ketamine because that is the only legal available option right now as a broadly psychedelic substance. As I mentioned, ketamine has been used in medicine for 50 years, so clearly it's a legal substance, although it has been used in recreational settings with previous as well. And other substances in psychedelics, including psilocybin, MDMA, LSD, they are still not legal. They were Schedule 1 substance,
right.
Meaning that they define Schedule 1 substance as basically a substance that has little
no medical use whatsoever. They're completely worthless. Yes.
Right. It's very interesting. That was the product of the Controlled Substance Act. But anyhow, so ketamine is the only legal substance that we can use to treat those conditions. in a clinic setting. Having said that, I think there have been a lot of progress in terms of the path towards legalization of those psychedelic compounds. So there are multiple cities in this country that have decriminalized psilocybin, for example, the magic mushroom.
Colorado just recently.
Right.
Yeah.
Yeah, exactly. And Oregon just like January this year, they just started moving towards legalization of magic mushroom usage. So under certain facilitation, and Colorado probably is going to take us some similar framework. And from the research perspective, MAPS just finished the clinical trial of MDMA for PTSD last month. And they are moving towards the filing for the FDA approval. So with all those movements, I would expect those substances to be approved by FDA eventually, and hopefully get rescheduled so that we can use as just regular medicine. Like right now, there's psychedelic medicine, which is not really seen as a part of the regular medicine. But I think psychedelic medicine is going to become just another medicine to be used for, for conditions. So
and soon,
yeah, that has to happen, and I think that will.
So you decide to branch off. You're aware of these chemicals being useful, and you decide to create your own thing. So how did it go in terms of creating a business around this new hotly contested area for yourself? And how has the experience been now that you've been doing this in terms of treating your patients or clients, or however you refer to them? What have you witnessed, and what propels you forward in this line of work?
And what we're seeing in the clinic is pretty remarkable. It is not surprising just based on those research papers that's already out there, but we do see very significant improvement of the symptoms among patients who have been struggling with depression and anxiety for years. And many of them are seemingly functional. Many of them have a full-time job and they're working hard, but at the same time they're struggling with all those symptoms of depression and anxiety. They tend to have some underlying trauma. They are aware of those things, but it is really hard to address them in a way that is a healing process for them. And ketamine has been beneficial for those patients to be able to actually feel those emotions or revisit the experiences that they had in the past. So those things become the material to be discussed during the psychotherapy sessions, which we call the integration session after ketamine dosing session. And that really improved many of our patients, the symptoms. And some patients even said that I've never felt this good in my life. And those are the moments that we really feel fortunate to be able to operate in the space.
So for the people out there who suspect that they might be depressed or clinically depressed, or people who know that they're depressed and might have treatment-resistant depression, what would you say to them in terms of helping them get the treatment that might help them? Or if they want to get involved and take ketamine-assisted therapy, what should they do?
Yeah, first, I would ask your own doctor or psychotherapist about to discuss the treatment in detail. Ketamine is not for everybody, but if you are on certain treatment and you're not feeling better, you should bring it up to your clinician. And many clinicians will be happy to discuss the alternative treatment, maybe switch to one medication to another, or using different psychotherapeutic modality to make you feel better. That may be the first step. And if ketamine comes into the conversation, your clinicians may be able to provide it to you. That's great. And if that's not the case, we're always here to support the patients like you. So you can find us on our website. Our website is at isha.health, isha.health. There's a lot of information on our website to read through about the treatment, how we deliver the treatment, and we offer the first consultation for free because we don't want to charge people who don't actually go through the treatment with us. So if you wanted to learn more about the treatment or discuss with me for the full consultation, you can book me at our website as well.
Well, that's fantastic. I think it's a tremendous field with incredible potential, and I really hope that people around the world start recognizing it seriously, governments, and everybody starts rescheduling these things, because I believe they do have a profound use. And that's why it's been so interesting for me to talk with you today and to hear a story of somebody who's actually doing it, because more and more these types of things that were out there and external, they're becoming a legitimate career choice. It's something that somebody can actually pursue. You can go to UC Berkeley, you can take courses, you can make a difference in this field, and you can build a career in this field. And that's the part that I appreciate of you sitting down here and sharing your time with me, to make people understand you can be a part of this movement if that's something that you value, which is just awesome. So thank you very much for taking the time to join me. I really appreciate it. And thank you for what you have done and continue to do. I'm sure you're going to benefit a lot of people in your life, which is fantastic. And yeah, it's been a great conversation. So with that, the official conversation, the official podcast is over. Thank you. Thanks again for listening to another episode of the Beat the Often Path podcast. If you've enjoyed this episode or any of the episodes we've shared, it would mean a great deal to me if you subscribe to the podcast on your platform of choice or on YouTube. And of course, if you shared either the show itself or this particular episode with somebody who might want to hear it to help us grow the audience for the show, I would greatly, greatly appreciate it. So if you've been a passive listener all this time, I get it. I understand. There's no big deal with that. But it would really, really mean a lot to me if you'd leave a positive review and help me grow this show. So thanks again for listening, and I'll see you next time.